Welcome to Beyond the Skin Med Channel. Today, let's simplify the anatomy of the lungs by discussing them under the following headings. Introduction. The lungs are a pair of spongy, elastic respiratory organs located within the thoracic cavity. They are the principal organs of respiration and are responsible for gaseous exchange between the atmosphere and the blood. Functions: exchange of oxygen and carbon dioxide, maintenance of acid-base balance, filtration of small blood clots and air bubbles from circulation, production of surfactant by alveolar cells, contribution to voice production by supplying air for phonation. Location. The lungs lie within the right and left pleural cavities of the thorax, separated by the mediastinum. They extend from just above the clavicle into the root of the neck down to the diaphragm. Shape. Each lung is conical in shape with an apex directed upward and a base which rests on the diaphragm. Color. The human lungs is rosy pink in color. Note that the color of human lungs varies significantly depending on a person's age, health, environment, and lifestyle. While we often picture lungs as a uniform color, they actually display a wide range of hues based on what they have inhaled and how they are functioning. Weight. The right lung weighs approximately 600 to 700 grams, while the left lung weighs approximately 500 to 600 grams. The right lung is heavier because it is larger and has 3 lobes, whereas the left lung is smaller due to the cardiac notch accommodating the heart. Lobes. The right lung has 3 lobes: superior lobe, middle lobe, inferior lobe, while the left lung has 2 lobes: superior lobe, inferior lobe. Fissures. The right lung has 2 fissures, which are oblique fissure, horizontal fissure, while the left lung only has 1, which is an oblique fissure. These fissures separate the lobes of the lungs. Please note that lobes and fissures are not the same thing. Lobes are the major sections of the lung, while fissures are the grooves that separate the lobes. Borders. 1. Anterior border. Thin and sharp with the left lung showing the cardiac notch. 2. Posterior border. Thick and rounded, and it lies adjacent to the vertebral column. 3. Inferior border. This separates the base from the costal and mediastinal surfaces. Surfaces. The term surfaces of the lungs refers to the different outer faces or sides of each lung. These surfaces are named according to the structures they face or come into contact with inside the chest cavity. 1. We have the costal surface, faces the ribs. 2. Mediastinal surface, faces the heart and other structures in the mediastinum, and it contains the hilum, where structures enter and leave the lung. Then, 3. The diaphragmatic surface, rests on the diaphragm. Arterial supply. Under this, we have functional and nutritional supply. Functional supply. Right and left pulmonary arteries carry deoxygenated blood from the heart to the lungs. Nutritional supply. Bronchial arteries supply oxygenated blood to lung tissues, usually 2 left bronchial arteries from the thoracic aorta, 1 right bronchial artery from the aorta, or an intercostal artery. Nerve supply. The lungs are supplied by autonomic nerves from the pulmonary plexus, formed by parasympathetic fibers from the vagus nerve and sympathetic fibers from the T1 to T5 sympathetic trunk. For easy memorization, nerve supply of the lungs equals pulmonary plexus, parasympathetic equals vagus nerve, sympathetic equals T1 to T5 sympathetic fibers. Venous drainage. In functional drainage, 4 pulmonary veins, 2 from each lung, carry oxygenated blood to the left atrium, while in nutritional drainage, bronchial veins drain into azygous vein, right side, hemiazygous or accessory hemiazygous vein, left side. Lymphatic drainage. Lymph drains through superficial, subpleural lymphatic plexus, deep lymphatic plexus. Lymph then passes to pulmonary nodes, bronchopulmonary, hilar nodes, tracheobronchial nodes, paratracheal nodes, bronchomediastinal lymph trunks. Clinical significance. Pneumonia. Inflammation of lung tissue, usually caused by infection, leading to impaired gas exchange. Tuberculosis, TB, a chronic infectious disease caused by Mycobacterium tuberculosis affecting lung tissue. Pneumothorax. Presence of air in the pleural cavity causing collapse of the lung. Pleural effusion. Accumulation of fluid in the pleural cavity. Lung cancer. Malignant growth arising from lung tissue, commonly associated with smoking. Atelectasis. Collapse of part or all of a lung due to airway obstruction or compression. Chronic obstructive pulmonary disease, COPD. A group of diseases characterized by airflow limitation, including emphysema and chronic bronchitis. Asthma. A condition involving reversible narrowing of the airways, causing difficulty in breathing. Pulmonary embolism. Blockage of a pulmonary artery by a blood clot, reducing blood flow to lung tissue. The lungs may look simple at first glance, but their anatomy is packed with fascinating details. Which feature surprised you the most? The cardiac notch, the fissures, or the difference in lobes? Let me know in the comments, and don't forget to like, subscribe, and share for more.